Hi, Dr. Holly here. I am the medical director at the University of Colorado Anschutz Health and Wellness Center and medical director of season 5 of ABC's Extreme Weight Loss. And I hope everybody got to see Jackie's episode last night. It was a great episode. She's a local girl here from Colorado, has a huge heart, and I hope that she is part of our Anschutz Health and Wellness Center family for years to come. When I sat back last night and I looked at the whole episode, and I'm always trying to come up with what I think the biggest learning is. You know, there's so many things in this episode that could be important. But when I sat back and said, what's the thing that I think the most people can learn from? It really came down to feeling your feelings. I think so many of us don't do that. And let's face it, we're in a society that when we do have a negative feeling, when we feel pain, the knee-jerk reaction is, let's take a pill. Let's immediately get rid of it. When we feel anxiety, let's immediately get rid of it. If we're depressed, we shouldn't feel sadness. Let's immediately get rid of it. But sometimes I think you do need to feel your feelings. You need to go through a process of feeling some sadness, of feeling some pain, and dealing with it instead of trying to get rid of it quickly. And in Jackie's case, and in so many of my clients' case, I think the knee-jerk way to get rid of it is to eat, is to try to numb it with food. And we definitely saw that with Jackie. I think she was doing that for almost 15 years prior to having her transformation. Anytime she would feel some negative emotions or those emotions around Hunter and that tragedy would bubble up, she would go to food. And she would try to just numb them or push them away instead of really dealing with them, going through that process and coming out the other side stronger. So my homework to everybody is to be aware. Be aware of what you do with your feelings, especially the negative ones, especially fear-based ones, sadness, anxiety, those types of feelings. What do? Do you allow yourself to feel them, or do you tend to try to do the quick fix? And a lot of times that quick fix involves food. So this week, if you catch yourself in front of the refrigerator for no reason, if you catch yourself eating something when you're not really hungry, think about it. Are you doing this because you just had some type of emotion and it's your knee-jerk way of getting rid of it? I know that that's very common for a lot of my patients. So the first step, if you want to change that, is to be aware. So go to the Dr. Holly page this week. I think it's important for us all to share the fact that we tend to do that. And a lot of the Status Slimmers and Destination Boot Campers have used other strategies instead of food. I think that's a key learning anytime you're going through a transformation. You become emotionally stronger, more emotionally resilient when you have other strategies other than food for dealing with your emotions. So until next week, I hope everybody has an amazing week. Continue on with your transformation, and I'll see you very soon. Bye.